Hello, everyone. My name is Madeline Hooten. I am a doctoral candidate at Arizona State University in the College of Health Solutions, and my mentor for the last almost 4 years now has been Dr. Raminta Daniel-Latite, and we've been focused a lot on substance use and drug use trends in the Phoenix area, and specifically those implications with heat. I'll talk a little bit about my dissertation at the end and what my trajectory looks like for that. But for the purpose of this presentation, I'll primarily discuss some work that we did as a lab under the direction of Dr. Daniel Atite, primarily looking at drug use trends, homelessness, and the heat response in Phoenix. Perfect. Okay. So just to preface this is a study that was built as a pilot study out of the Arizona College of Health Solutions under our Heat and Health pilot project. The full title was a double blind of risk, exploring the intersection between environmental heat and drug overdose crisis in Phoenix, Arizona. And here are some of the other co-PIs and RPI, and here's our team, Kaylin and Patty as well. So the aim of this study, again, to preface, this was done last summer, so in 2024. The aim of the study was to characterize how individuals who use drugs perceive and navigate environmental heat-related risk in the context of their daily drug use practices, physical and mental health comorbidities, and access to social and health services. So this data collection occurred at our downtown campus from June to August 2024. The eligibility criteria was pretty similar to what we use in a lot of our studies, and because of the specific population, but 18 years or older, currently residing in the Phoenix metropolitan area, and past 30-day use of opioids and or methamphetamine, because specifically those, because we see those as the two most primarily used substances amongst this group, and then experiencing homelessness in the past 5 years. So this study, we did in-depth qualitative interviews and open-ended conversations about these participants' experiences and life stories, from what started their initial use into where they're sort of at now and how they got to this space. And then these interviews lasted about an hour and a half, sometimes 2 to 3 hours, depending on the participant, and they were conducted again at our downtown campus. So we recruit in a couple different ways. We primarily would post on Craigslist. You'd be surprised, our phone that we use gets blown up every time we post on Craigslist. It's been a really helpful tool for us. We also shared flyers with our harm reduction agencies that we also use, some of those within our city, public health, but we also coordinated with them and had them do that as they were doing outreach to different individuals in the community, and then also posted some throughout Burton Bar Respite and the libraries. A lot of you guys know, Burton Bar was a 24-hour respite last year, so we utilized that space as well to get the heat aspect. And then participants were compensated for completing these interviews. They were compensated $50, a bus pass, and then information about heat relief sites and harm reduction supplies like Narcan. And we provided some of the heat relief material that we also use within the city. And then for logistics, the study was approved by the ASU Institutional Review Board. So some of the participant characteristics, we primarily saw male participants, and the age range was pretty in the middle, but it was 30 to 70. And then the mean age was about 46 years old. And then a lot of individuals reported being single or separated, and most of our participants were unemployed. This is the primary demographic makeup of our participants. As you can see here, we primarily had white males as our participants. We see this commonly in literature with those specific substances and those in the population that are typically reported, but this was our primary demographics within the study. And then when we ask individuals where they've lived in the past 12 months, this is the different responses that we received. Primarily, a lot of individuals did report living on the street in the last 12 months, whether that was recent or they had just, they've been in homelessness for a while. And then a lot of other options were also reported, like living in a house or apartment or living with friends and things like that. And some interesting stories about people living in their cars during the heat and how they mitigate that we'll talk about later. So in terms of experiences of homelessness, of the 34 people we did interview, most of them did report more than 5 years of homelessness, and that was over half of our participants. And then a little less than half, but right around that mark, reported ever using any kind of homeless shelters as well. So we ask a bit more in depth about these in the interviews, but this is sort of the initial information we got from participants. And then drugs used in the past 30 days, kind of like we use with our eligibility criteria. A lot of participants primarily use methamphetamine. Cannabis, which is interesting because we're seeing a spike in that being reported at our HEAP centers now this summer, but cannabis was reported, and then fentanyl blues was also reported. So primarily methamphetamine were the two illicit drugs that were reported the most. In terms of heat-related risk, we did ask participants if they've ever experienced heat-related illness, if that meant a heat stroke, if they were hospitalized, things like that. And over half of our participants reported experiencing some kind of heat-related illness, whether that was on the job or if they were out and they weren't able to seek shelter or did not for some reason. And then if they've ever visited a hospital due to heat-related symptoms, and 26% of our participants reported going at some point. So again, that's not to say that there's some individuals, obviously, for a multitude of reasons, like feeling stigmatized, or maybe they weren't able to physically get to a hospital, that they might have not sought out that care, but that's just something to note. So briefly, I want to talk a little bit about some of the perceptions about methamphetamine and heat-related risk. So a lot of participants, like you saw, reported using methamphetamine and had unique insights related to the benefits and risk of using that during the heat. So some of those were reflecting on the risk. So most of our participants recognize that methamphetamine increased heat-related risk. As we know, it can increase their temperature and reduce like their intake of water and food, suppressing their appetite. So example, this 59-year-old man had mentioned it dehydrates you. He says he's one of the stupid ones. I don't drink water when I'm tweaked out for some reason. I can't drink. I wait till I'm almost, in desperation. I don't know why that is. And so this participants really talked about how it does suppress the appetite, so much so that even when you are in extreme heat and you're outside and these things, you might not always keep up with your hydration and eating and things like that because of the effect that has on you. Some of the other risks, some also noted increased risk because it increased anxiety, paranoia, and made them feel like they needed to keep moving and walking around. I know a lot of us do work in this space, and we know with like, especially the homelessness population, a lot of times individuals might experience a lot of paranoia and anxiety, especially when you're having to move from point A to point B consistently. So this 49-year-old man had said, oh, when you're on meth, it makes you walk because I don't want to do things, or sometimes I'm just trying to get away from voices or people. So you cannot stay in one place. It's hard to stay in one place, and it's a bigger risk, especially with the heat. So some of the downsides of using it in this space was it might have made it harder for someone to want to seek some kind of like cooling center, things like that, because of the paranoia or anxiety or feelings that this might have alluded to, on top of the other risk of like dehydration and suppressed appetite. And then another piece on methamphetamine and the heat was some of the benefits of how it helped them survive the harsh pieces of the heat. So this participant mentioned to help them cope and tolerate mental and physical misery of homelessness and heat. Using meth makes the heat more tolerable. Even if you're burning up or you need water, it feels like you can go without that because you have like this uptake of methamphetamine. So this participant mentioned, like, I don't want to go in the store, because like I'm being paranoid, or I know I'm really dirty, or, I don't want to go in there. So I'll keep going and keep going. So there's risk and benefits associated with people feeling like they can stay on the go and be more alert, which is helpful for safety and other reasons, but also the other side where participants mentioned it still makes them feel paranoid, and there's still concerns for dehydration and that reduced appetite. But to some extent, it also helps them bear with the harshness of homelessness, especially in the heat, because of those aspects. Sorry, I'm speeding a little. I want to make sure we keep time, but also want to talk about heat relief site knowledge and utilization and what participants said about their perspectives of the cooling centers. And then I'll talk a little bit more about my dissertation and finish. So when we asked participants about the heat relief sites, this was broad encompassing. If you've ever used any kind of cooling center, whether it was the hydration sites, like a respite, anything, a church, things like that. So 22 participants of our 34 indicated ever using heat relief sites. That was over half, which was helpful. And then 35% reported regular or extensive use of these cooling heat relief sites, I'll say generally, because I know cooling centers mean something different with the city. But in general, extensive use of these facilities. And while no one used or was limited to, we were asking them what they knew about them and how they decided to use them, and what resources they rely on. A lot of people had mentioned that they found them really helpful, but there was other aspects like they couldn't leave their pets, or their other belongings. Maybe the location was inconvenient, maybe in proximity to the light rail, or even just walking from wherever they're coming from. And then some people did mention prior negative experiences, like maybe having their things stolen or things like that. This one specific woman, she was 54 years old. We had asked her, so have you ever used the heat relief sites in Phoenix area? And she mentioned a couple times, not so much because, again, she had pets. And if she's trying to cool down, they're also going to want to cool down. And people look at her weird, because she has cats with her. And she has her cats in a dog kennel. And so she just has a lot of that she's carrying with her already and her animals. So it made it inconvenient for her to go to the cooling center. I know this year we have a whole different setup for pets and things like that, but this is what people had reported last year and their experiences. And having other resources to rely on, like some people mentioned they'd go to a friend's house to cool off, or maybe they had a car and they would occasionally turn on the AC. Some positive experiences with the cooling or with the heat relief sites overall. Participants mentioned they appreciated their ability to access air-conditioned spaces and escape the heat. They appreciated access to other resources, free water, food, snacks, phone charging, free Wi-Fi. Some sites allowed them to lay down and get some sleep, which was helpful. And then some sites, I think like some behavioral health sites had organized like recreational activities, like they could watch a movie or they could participate in some kind of activity. And then some appreciate the kindness of staff and connecting them to community resources and being able to connect with other community members like, oh, my friend goes to this one, so I'll go there too. And then a few people indicated that while they visited the sites, this helped them limit their drug use because, like we saw, some people would report using meth to help them stay alert and be active during the day to avoid the heat or make it more tolerable. But if they were in these sites, they obviously couldn't use that. So it helped them cool off and also prevent them from maybe overusing. A 35-year-old woman had said that they're really helpful. It's nice to be able to go somewhere that you can charge your phone and get water and not get arrested or kicked out. So it felt like a positive experience. And then a 40-year-old man had said, I think they're doing a pretty good job with that, with what they have going on. And people are not going to take help if they don't want it. You know what I mean? And it's really up to the individual to use the facilities. So that was an interesting sentiment we saw. Some people would say, oh, they could do more. But other people were like, they're doing what they can with the resources they have. And this is really great for me. And then just some negative experiences. Overall, some people had mentioned that some sites were overcrowded or low on resources or food. Some sites did not allow people to lay down and sleep. And for some individuals, being in proximity to other clients, it made them feel uncomfortable, vulnerable, or irritated, especially if they weren't able to leave their things and stuff like that. And then some expressed dissatisfaction with the security protocols, which reminded them of jail-like conditions. I think that was specific to a very specific location that had additional security because of its size and proximity with community. But we can get into that later. So a 35-year-old woman had mentioned that Burton Bar one was getting a little bit crowded. Her bag had gotten stolen while she was there the other day. And she mentioned it was just the same thing she had been dealing with before in any public place, but it's cool that we have them and they help, but still that concern for like her safety and being able to manage her things. Okay, I'm almost finished. So broadly, that's why we've talked about this study that we did, this pilot study as a lab under Dr. Dana Latite this last summer. And because of that work, I'm pursuing sort of another approach to how we're looking at heat, substance use, and homelessness for my dissertation. So I recently proposed my prospectus, and I'm going to be looking at substance use, homelessness, and heat relief, a mixed method study of cooling center utilization in Phoenix, Arizona. So while we were broadly looking at perceptions of what substance use and homelessness look like in the heat and how people use these resources, I'm primarily wanting to look at cooling center utilization for my dissertation, and I'll talk about my 3 approaches to that. So where am I, aside from the study that we had just discussed that sort of pivoted me in this direction, what I noticed in the literature was there are some gaps that I felt like could be filled, specific barriers to understanding utilization as a whole. There was previous surveys I'm sure you guys are all familiar with or even helped conduct, where Maricopa County had asked residents to answer questions of how aware they were of different cooling centers. And what the study found in 2023 was that over half of the county residents that were in the proximities of cooling centers were aware of them, a vast majority were not visiting them or using them. And a lot of times they attributed that to a lack of familiarity with the locations and available services. And of that survey, less than 5% of those who did fill this out were substance use and homelessness involved. So the goal of this study is to take what we know is such a vulnerable population who have consistently topped our heat-related deaths in the county and state over the last few years and understand their perspective of how they're utilizing and accessing these resources. Like I said, high-risk populations, including those with substance use and homelessness, are often underserved or underrepresented. And so that's sort of the premise of my dissertation. So what we don't know currently is there is limited data. There's a lack of real-world data on how vulnerable populations like those with substance use and homelessness utilize these centers. And then the implementation effectiveness. Maricopa County is one of the most vast cooling center networks that I've read about and seen and interacted with as also a city employee. And there's still little evidence on how these cooling centers are being utilized by those in high-risk settings, specifically homelessness and substance use involved, and with overlapping vulnerabilities. So the goal of this is to focus on equity research to develop more effective user-informed interventions that are clearly data-driven based on what we're seeing. And Maricopa County is a great place to do that. So the purpose of my study is to explore cooling center use, investigate how individuals experiencing homelessness and substance use in Phoenix specifically are accessing and using these resources, identify barriers and facilitators to examine how utilization is done on both the user perspective, so any community members using them, but also the staff perspective and what that looks like, and then informing future decisions in my collaboration with the city. So my last slide, this is my 3 aims. So my plan for my dissertation is to first look at temporal patterns of cooling center utilization by location based on the amount of visitors that we saw last year. So I'm going to be using all of our heat relief intake data that we got last year and look at over time if there's changes in like how different groups are using them, specifically those substance use and homelessness involved, why we're seeing spikes at 6 p.m. when we know it's still hot at 9, things like that. So I'm going to be looking at heat relief intake forms. My second aim, which I'll hopefully start recruiting for this next week, is to look at the knowledge, attitudes, and experiences related to cooling center access and utilization among those substance use and homelessness involved. So I'll primarily be at our new cooling center this year, the 20 West Jackson location, recruiting individuals, and then in partnership with our harm reduction agencies to recruit individuals currently reporting substance use and homelessness with the same eligibility that we used in Dr. Yanitza's study, and interview those individuals to understand their experiences. And then my third aim is to look at the lived experiences and practices and the organizational dynamics of a couple of cooling centers we see within the heat relief network. And I'll primarily look at those that we saw our participants report a lot of last year when we did that other study. So a lot of them went to churches downtown, Taros, Social Spin, a lot of really specific ones, and then some of our city operated ones. So I know it's a lot and I rambled through that, but the goal of this is to really build on what we found in Dr. Jane Letite's study and get a really clear understanding of where these different dynamics are occurring from both the community member perspective, but the staff perspective, and how we can continue to understand utilization, especially among those most high risk. And I think that is it. Thank you.